Hi, my name is Ashley. I'm going to be your nurse today. Can you tell me your name?
Ashley,
And how old are you?
29.
Okay, so today you're in for a head-to-toe assessment. I'm going to be listening and touching several spots on you. It doesn't mean that anything's wrong. We just want to make sure that we're doing a thorough assessment, okay? Do you have any questions?
No.
Okay, well, throughout the exam, if you have any questions, just stop me, okay? So the first thing I want to do is I just want to ask you a couple of questions. Do you know who the president is?
Donald Trump.
And do you have access to 3 meals a day?
Yes.
Okay, looking at your overall appearance, you look clean, things like that. Okay, so I noticed also when you walked in that your gait looked good. You had good posture. I didn't notice that you used any assistive devices. Do you use anything like a walker or a cane or
No.
anything like that? Okay, and is English your natural language?
Yes.
Okay, and we did do your height and your weight when you came in, and that seemed appropriate. Your BMI seemed appropriate to your height and your weight. And then just looking at your posture sitting here, everything looks nice and straight. Don't see any abnormalities. So now that's it for your head to toe. So now I'm gonna give a report. Okay, so I'm gonna give a report on a 29-year-old female who came in for a head to toe assessment. We started off just asking her, her name and her age. She was alert and oriented ×3. She had great nutritional status so that she had access to 3 meals a day. Her BMI was, accurate to her height and her weight. She didn't have any physical deformities. She stated that, she didn't use any devices. Her posture was straight. Her gait was good. She didn't use any of those devices. She stated that she was in a good mood, that she was happy, that she stays in a good mood. Her natural language is English, and she was nice and clean today. So after that, we started off with her skin. We looked at her hair on her, and for color, it was appropriate to her race. It was warm and dry to touch. Her hands and her nails beds were clean. Her capillary refills were less than 2 seconds. We did her peripheral pulses, which were her radial and her brachial. We palpated those. We moved down to her head. I checked her scalp. It was nice and clean. There was no dandruff noticed, no redness. We checked for any bumps, lumps, or bruises. There was not any. She denies any tenderness when we did palpation. The hair color was light brown and clean. I moved down to her face. Her face was nice and symmetrical. We did cranial nerves 1 and 2. Those were all intact. Her temporal artery was palpated. We didn't do any, there was no thrills noticed. She denies any tenderness to the maxillary and frontal sinuses. Then we moved down to her neck. It was negative for any pulsations. We didn't feel any lumps, bumps, or bruises. She denied any palpation or tenderness of the trachea of her neck. Her trachea was also midline. We did lymph nodes that were palpated. There was no tenderness. There was also no swelling. We didn't feel any enlargement in those lymph nodes. Then I checked her carotid arteries. I did inspection on that. There was no lumps, bumps, or bruises. No thrills to palpation. They were palpable in auscultation, both in her